So welcome everyone. I'm Varsha Singh and I'm here to bring you the brand new Healthline show which is going to be on TVAsia Telugu channel. I'm really honored and privileged to be part of this show as this show is all about community education, healthcare advices, which is coming from the specialists who are practicing it daily. These are the specialists who will bring you what is current treatment plans, what are those healthcare advices that you need to follow to maintain your health and improve the quality of your life. We all know today that social determinants of health are the main reason that we are not able to contain or control the healthcare cost. The rising healthcare cost can be controlled or reduced only through preventative medicine. That means taking care of yourself before the disease starts. So let me introduce you to the guest today, our specialist today, Dr. Pradeep Shah. Dr. Pradeep Shah is a veteran as a practitioner of infectious disease. He has treated many patients as he is in his practice for more than 25 years. He is known for his practice, his expertise. He is valued for his opinion, and his patients can vouch for his treatment. I'm really proud to share that Dr. Pradeep Shah is current president for the medical staff at Hackensack Meridian, JFK University Medical Center. He is also the secretary of AAPI, and he is infectious disease specialist who is serving at more than 2 to 3 hospitals in Central, Jersey, and Union County and Middlesex County. So welcome, Dr. Pradeep Shah.
Thank you.
Dr. Pradeep Shah is very well known for his opinion for all kinds of infectious disease. And as we all know, today, the entire country, not just entire country, I would say the whole world is fighting with COVID-19. So I'm going to ask Dr. Shah to say a few words because everyone wants to know about COVID-19.
Hi, everybody. I'm Dr. Pradeep Shah. As the Varsha, thank you for my introduction. This virus, what is called COVID-19, has been very disaster. It's not only one country. This virus has turned the whole world upside down. I mean, every country has been affected with this. Every person is affected. And let me just go back to what is the COVID-19 virus is. COVID-19 is a part of a called coronavirus. Coronavirus is a well-known to medical community. Usually, it occurs in winter, and usually it stays in the upper part of respiratory tract. What I mean by that, in the pharynx, in the nose and sinus. But somehow this coronavirus has become what is called mutation. Mutation is when the virus change their genetic structure, and it has become more virulent in the sense that it not only involves upper respiratory, now it goes down into the lungs where your oxygenation occurs. When you take a deep breath, the oxygen goes into your blood, and where the exchange of the oxygen happens. And that's where it causes the lot of inflammation, and it does not allow the oxygen to go into your blood. Even though you take the oxygen measure, it says 99% sometimes, but the actual contents of the oxygen is low. And that's why you can see the main symptoms of the COVID-19 is a fever, cough, and shortness of breath. When a patient gets shortness of breath, that's a very serious disease. So that is what happened to this COVID-19 virus. As we all know, it started in Wuhan, China, and it spread all over the world. I don't see any country that doesn't have that virus. And another problem with this virus is it's highly contagious. Now, what it means is it spreads like a wildfire. Like usually the flu virus, if somebody has a flu, he may infect 1 or 2 people or maximum 3 people. This virus, if a 1%, it can infect up to 50 people if they are in the same room. So the contagious is very highly contagious disease. And the other part is there is called the pre-symptomatic disease. What it means is when you acquire the virus and when you get a symptom, it's called pre-symptomatic period. And that time is very highly infectious. So people doesn't know that they have a virus and they start infecting. By the time they realize that the symptom is begun, the person may have not taken precaution, it may have already infected so many people. So this is the story, and that's how it has spread, and this is how, has become the more problem. And the problem because of contagious and the infectiousness of this disease. And that's why we have to take isolation part.
Thank you, Dr. Shah. I just wanted to ask you, now that the cases are becoming lesser and lesser in New Jersey, we know that New Jersey and New York both were hit really hard, and we had highest number of patients with COVID infection. Today, when we are looking at the numbers are significantly lower than what we had in April. I think the maximum number of cases in both the states were in April, and in May it started coming down. And now June, things are opening up. And I just wanted to touch on that point. Do we really need to think that the danger is over? And it should be a really important statement because we really do not want to see another peak.
Well, we cannot guarantee the peak will happen or not, but yes, we can take precaution. That is the most important. I agree that the numbers has gone down, but if you look at some of the other states where it's rising, like California, actually, in fact, I was looking at the news today, California and Arizona, they had the highest number of the cases today, new. So, yes, this is the disease. I don't think it's going anywhere. It little bit die down. If we don't take precaution, it can hit second wave, and we cannot predict when it will happen. So what we can do, yes, we still need to take a precaution. Social distancing is very important. Also, the mask is also important. I know people think that what the mask is going to do, but believe me, it does work. Let me tell you, we had done the study in our hospital, all 17 hospitals, and we tested the doctor who were treating the COVID, and they were taking the precautions. They used to use the personal protection equipment, and only 13% antibody came out positive, and nobody has a PCR antigen, which is active disease, is less than 1%. So what does it show? That the personal protection equipment does work. And we were all frontliner. We used to see the patient in a day, about sometimes 50 to 60 patients in a day,
Yeah.
And
Yeah.
so that is why, I think the mask important, hand washing, if you think that you have gone somewhere or you have touched that surface which may be contaminated, simple soap and water. You don't have to use all this sanitizer. Simple soap and water in 20 seconds, if you wash your hand, it's good enough to prevent the disease, And
That's correct. Yeah, that's a really great point, Dr. Shah. And I know that many people who are watching this, they are not healthcare professionals. I just wanted to explain them. If you could little bit elaborate, what does the antibody test mean, and what is the PCR test that you are talking about, and what is the significance of both?
Okay, so let's start with the PCR antigen. What it is, see, there are two parts in this. One is you directly test for virus, and that is antigen test or PCR antigen test. The other one is when you expose to any disease, your body fight back and they produce antibody. So that is the antibody test. Now, when you do and when should you not do? Let's go there. The PCR antigen test is the one they do the swab in your nose and on the throat, and they test it out. This is the direct measure of the antigen test, which is actually virus RNA testing, which is a direct test. Means if it is positive, most likely if you have begun the symptom, that is active disease. Now bear in mind that this PCR antigen test can be positive once you get it up to 3 months, because the virus, those are dead in the body, stays there in the body. So if you do test, RNA will be positive. It doesn't mean you have active disease. So you have to take it in the consideration what time of the disease you are doing, what is the, how many days you had a symptom or not, and will you have any other symptom like fever, cough, shortness of breath, and your oxygen test. So you have to do this test interpreters in the contents of the when you are doing this test. So that is called PCR antigen. And some people had asked me, they had a positive to begin with in the first week of the disease. Second week they were negative, and they did after third or fourth week, and it's positive. It's more likely if you don't have a symptom, it's more likely you are checking is the dead viral RNA, because virus can stay in your mouth, in the nose, in the respiratory tract for up to 3 months. So just test positive does not mean you have active disease. If you have begin the symptom, yes, this is, but if it is positive after 2 weeks, and if you don't have a symptoms, now symptom meaning that whatever symptom you had when you are diseased, and the most common is cough, fever, and shortness of breath. Of course, many people have a nausea, vomiting, diarrhea, abdominal pain. That also is a positive signing, but these are the most common. Also, the smell, you don't have a smell, or you are body pain, you are tired very quickly. Like in the morning you get up and you don't want to get up. That is a sign of a active infection. So those all symptoms, if you don't have, and if you have not taken the antipyretic, meaning the Tylenol, and if you don't have fever, this may be just a dead virus you are testing.
So, Dr. Shah, I'm going to ask you a question which may sound funny, but I came across a couple of people and they were very, very anxious, and they were not sure whether do I have coronavirus or not, or do I have this symptom, because people can get anxious about, even if they're feeling a little bit tired, they will say, oh my God, I'm feeling exhaustion, and do I have coronavirus? I have a little bit of cough, do I have coronavirus? So my question is, some of these people I met, they actually started practicing that they would wake up in the morning and they would spray a little bit of perfume on their hand and they would smell it, and that would relieve their anxiety that, okay, I can smell, my sense of smell is intact, so I don't have to worry about coronavirus. So would you say that, is it like 100% that all patients who have coronavirus, they lose sense of smell?
No, that is not. That's one of the symptoms. And bear in mind, if you have a sinus or common cold also, you cannot smell. Or people who have a chronic sinus problem, chronic allergy, they don't have a sense. So it's not. I think you have to take in the contents of what are the other symptoms also. The person who, I think in the beginning of the disease, the first sign comes is the smell. You don't have smell. Then your appetite goes down. You feel feverish, cough, and so on. But it can be taken any order. It's not that always that is the case. Because whatever I have seen, I think the smell is only 30 to 40% people who lose smell. It not everybody lose the pain. The most important symptoms we have seen is a fever, cough, and shortness. Fever particularly, you take Tylenol, you take Motrin, it doesn't go away. And the frustration or the tiredness we have seen. I have seen the people who cannot get up in the morning after night sleep and everything, still they look, because their body pain, they are so tired and they can't get up. So the symptoms are a lot of varieties of symptoms. When you are in doubt, you can do, if you have never had a disease, you have to use is the antigen test. An antigen test has to be done proper way. You can't just stick your this swab in your nose and that you have to go deep into until you sneeze really. That is the real test that you have done the right way. Not necessarily, but that's where you should do it. Because if you didn't do the proper way, it can be 30% negative, false negative test, So it has to do professionally way. Also, it has to be do, also there are different types of antigen tests, but most of the tests now is very highly accurate. But if it is done properly, then still there can be 10% false negative. It doesn't mean that you don't have but the most important part, you have to test it out.
Thank you so much, Dr. Shah, for talking about what are the symptomatology and what should patients look at their own symptoms before they think that I really have COVID. My question is, they really need to seek care. I know many patients who really get anxious and first thing they think of is going to emergency room. So what is something that they can do at home and they really don't need to go to emergency room? If you can advise them whom to seek first, whom to reach out to first.
Okay, so the first one they have to think, if they have any doubt or they don't know whether they have a COVID or not, they should reach out to their primary care physician. But at the same time, if they have a shortness of breath or high fever or cough, I know that they don't all have a pulse oximeter, which is the measurement we do the oxygen on the finger. If they have it, they can check it. If it is less than 90, they need to go to the emergency room right away. But many people don't have it, so that's okay. You don't have to. But I will still advise people to buy that. It's only like $20-30, but it will be handy when you want to decide. It's called pulse oximeter. Basically, you put it in your finger and you can check your oxygen and pulse.
What is the number they should be looking?
The pulse ox, which is the oxygen, should be at least above 90. That's number one. And heart rate about 100, less than 100, it should be good. Now, having said that, if you don't have it, but if you feel short of breath, now what I shortness of breath, initially maybe you do routine, whatever you're doing routinely, and you get short of breath. Now, I didn't mean that if you go stare, many people get short of breath, but that's not really shortness of breath. But if you are sitting and if you have a shortness of breath, or you feel unusually short of breath, like you usually do routine work in your home, but you get short of breath, that is the sign, that is dangerous sign that need to go right away to the emergency room. The people who have only mild fever or that they don't have a smell or body pain, they can either call the doctor or they can make appointment and that test it out whether they have a disease or not. After testing out, if they feel okay, except shortness of breath, then they just home. Now, given that many advice has been done, many medication has come, what we call it a web cure. This is the new term.
Mm-hmm.
Meaning people are putting in the computer that this is good medication, you take it. I don't mind doing that, but bear in mind that they is not scientifically proved. Yes, it may help. Vitamin C is another one, vitamin D, people take it, which is good. People drink, boiled milk with some masala, they put it inside, And
there are many.
Mm-hmm. And I told them this is called web cure, because you read in your email and in the computer and get it there. But
so what I'm understanding from your advice is that you really want everyone to contact their primary provider rather than reading too much on media, social media, internet, or word of mouth. Because as per your advice, it is the specialist who would know the most current treatment, and they really need to first reach out to their primary provider And if they really refer, then they will have to see an infectious disease specialist. So
Right.
let me ask you this question again, Dr. Shah. I know that today we all are observing self distancing. We are trying to contain and minimize the contact between people, and we are trying to do everything remote. So, what's your opinion? What's your advice about setting up a telemedicine appointment for such cases?
I believe this telemedicine is very, very helpful, particularly the prevention of the spread of the disease. That is very important. And we are in front line. If we get all sick, then nobody will take care of the patient. So for us is also very important, not for ourselves, but for our patient too, because patient needs us when they come to the hospital. So the question is, telemedicine is very excellent, very excellent. And now we can do tele-video. So we can see the patient. Of course, we cannot listen to the lung, though there are some of them had that equipment in the nursing home where you can listen to the breath sound, listen to the heartbeat. But sometimes by experience, by looking at the patient, we know what the patient need to be hospitalized or no. So by doing the telemedicine or face-to-face, what we call it, it's very important to do that because you can see the patient, and if you know your patient, you can make out that something is wrong with this patient. Not necessarily COVID, but even something else is going on with the patient. So it is very, very important. The face-to-face is very important, and patient feels that they have seen the doctor, and that is confidence that they get.
This is something important that I really wanted our audience to know. We know that number one prevention is self-distancing, hand washing, and wearing mask when you are in public. Basically, you really don't want to have those air-dropped particles getting into your respiratory system. Other than the preventative measure and safe distancing, are there any other chemical or medical agents that you would recommend which will increase their immunity?
You mean the patient immunity? Well, yes, there are some of the measures. I believe that exercise is excellent to increase immunity. Now, I want to clarify what is exercise means, okay? I mean, everybody is there. I think basically the public knows that running, jogging is the exercise, but that's not correct. Whatever exercise you can do, I give my patient example. Let's say you are watching TV, like you're watching this video or show on the TV. You can move your hand this way. You want this, your hand, you can move your leg. This is also exercise part of it, okay? And you need to move your body, any parts of the body. It doesn't have to be running, jogging, or anything. But even you can raise your hand like this. Everybody can do. So you imagine that you are watching this show for 30 minutes. And if you do 20 minutes like this, it's a good exercise, okay? And the reason for that is that your body utilizes oxygen, it moves the oxygen, it also utilizes sugar, because sugar is the most dangerous for the virus and the bacteria to grow. And you want to reduce your blood sugar. That's why diabetes people get infection very quickly, and they are with. We didn't talk about the underlying disease, what can cause, but I think I'll leave it to the Pooja.
And that's a really great point, Dr. Shah. What I understand from your advice is that you are advising our community members that be physically active no matter what. And especially if people do not know how to start their exercise, what I can do, I think there are a lot of resources. They can always call an exercise specialist. They can take consultation from their gym exercise specialist. And now there are a lot of apps, online apps that they can use. So basically, being physically active is actually preventing any diseases like COVID. And also, I would like you to elaborate the other comorbidities that can increase the risk, which
Okay.
you were about to share with us?
Yeah. So the comorbidity includes underlying any lung disease, which is the worst. Diabetes, blood pressure, heart disease, congestive heart failure, any cancer, or you are on immunotherapy, or for the cancer therapy, all this reduces your immune system. So, in other words, your fighting body of infection goes down very tremendous. Particularly diabetes is one, and the underlying lung disease. If you are a smoker, you try to quit smoking because that causes more problem of that also. Control your diabetes, control your blood pressure. If you have a congestive heart failure, make sure that you have no symptoms of congestive heart failure. And all this is very important. But most important part, be active. I don't care even you walk 10 steps and sit down and then walk 10 steps or do. But active is very important. That boosts your immunity, that brings your blood sugar down, that increases the oxygen in your body, which all help to fight it back, this virus.
That's really a great advice, Dr. Shah. And exercising or physical activity, it is said by American Heart Association that more than 30 minutes every day, it reduces the risk for heart disease, it reduces the risk for stroke. Now, additionally, it is going to increase the immunity and reduce the risk for COVID as well. This is such a great information for our community members, and I hope that they really use it in their life daily, like a specialist advice, and it is free from the show. So, my final question to you will be, Dr. Shah, what would be your message to all our community members, because you have treated so many patients in this pandemic, and while you are giving your message to our community members, if you can share one patient story that you really specifically remember, and I know that we never disclose any identifying information, but it will give an insight to all our viewers, and this experience will actually give them some insight how to stay healthy and safe in this pandemic till all our vaccines or some degree of treatment is available.
Okay, I'm just trying to think which patient should I talk, and yeah, I can talk. See, one of the very prominent person, actually, I don't want to give the name. He's a very good friend of mine, and he calls me and tells me, Dr. Shah, I have a fever for 2 days. So I asked him, did you expose yourself or nothing? Yeah, he said, I went to the New York, for some business party and all that. So I asked him, when was the New York visit you had and when your symptoms started? So it fit into what usually this virus when you are exposed to virus, there are 5 days where you don't have symptoms, which is pre-symptom. Then at fifth or sixth day you start having symptoms. Roughly, I mean, this is not everything in hard and fast rule, but roughly and symptoms. So he fit into that. So I told him right away that, are you having shortness of breath? And he said, yeah, I'm getting little short of breath. And I told him to come right away to the emergency room. I say, you before get delayed, you come to there, because we can do the blood test, we can do the oxygen level and see whether an X-ray. Good enough, he had an X-ray which is bilateral pneumonia, which fit into this. So I told him that most likely you have and you need to get admitted. And the pulse was 90, 91, but it's borderline. And it's a beginning because I don't know how far he will go there. So we admitted, we started treatment. At that time, we didn't know what to treat, but whatever knowledge available. By the way, whatever I say this episode, it's what we know. It can change. Many things can change. We only know this virus tip of the iceberg. We still don't know the iceberg, how deep it is and what it is. Okay, so whatever I have told you so far is what we know as of today, and many people we still don't know anything about this virus. So having said that, basically he was admitted. He was in the hospital for a while. Fortunately, he did not get intubated in the machine, but he was sick. the everyday symptom, I cannot breathe, I cannot breathe. And oxygen was in 90, sometime 85, 88. He walks, he sit up in the bed, he gets shortness of breath. So make his story short, we treated him, he was almost, I believe, 47 days in the hospital. Then we moved him to the acute care hospital, acute rehab, where he got better and he's home right now. But still, he said that still shortness of breath. So what has happened in this patient is virus is gone, but it has done the damage to the lung, where your oxygenation, when you take a deep breath, oxygen goes into the blood, which we call it alveoli level. It's damaged, and the oxygen doesn't go basically in. But he's improving slowly. So the inflammation and damage is improving and he's getting better, but that is the problem. So in short, there are now a lot of medication available, not proven, some of them not proven that, but the number one is, we call it convalescent plasma. That person who had a disease who recovered, we giving, that's number one. Then there is a remdesivir, which is antiviral medication. Number three, hydroxychloroquine. Now they have come out in the England about dexamethasone, which is the steroid to give when the patient is sick enough to give it, to prevent the damage, what is inflammatory reactions, or we call it cytokine storm, all those terms are there, which is used. But I think we are still better prepared than what it hit really. We didn't know what we were facing, what we knew. We knew the virus has come, but we didn't know what it is. And a lot of theory has been put up in everything. And we are still learning. And still nobody has a one guideline. And it also depends on how patient present. The patient present with mild symptom, they don't even admit the patient. Patient goes home and because isolate themselves at home. In the hospital, it depends on what stage of the disease they present and we treat accordingly.
So thank you so much, Dr. Shah. I think the message that I can summarize from your talk is, number one, do not underestimate this virus. It's not over yet. We really need to be diligent, washing our hands, self-distancing, and we're making sure that our mask, and again, the mask which covers the nose, not which is hanging down, just on the lips, correct?
Right.
And then you also said that early treatment, seek early treatment, which is very important. And your example that you gave about your friend, he was treated early. Even though there was a long stay, he is still improving. So there is a positive in that again. And lastly, you said there are many, many treatments available. So now we are after 3 months, I would say March, April, and May. In June, we are optimistic that if a person reports early, then we have multiple different ways to treat this patient. So there is actually prevention and then treatment, they are all available. And I also understand that there is a lot of research which is underway to find out what is the best possible way to tackle this pandemic. So with this message, I hope this community has had a wonderful session of advice from very specialist in infectious disease. And I believe that this presentation will benefit and it will help them to take care of themselves in a better manner with a better understanding. So I really thank you for your time and your advice and the energy that you showed in this show, Healthline. Thank you very much, Dr. Shah.
Thank you very much. Good luck to everybody. Be safe, safety, and social distancing, and wear the mask and hand wash. This is the measure. You have to take care of yourself. Thank you.
Thank you so much.
Thank you.